name is Tim Maria, guest host for Informed Health 2015 here at UCSF in San Francisco. We have my good friend and one of the instigators, the perpetrators, the creators of Informed Health, Dr. Aenor Sawyer. How are you doing?
I'm doing great. We had a really amazing, inspiring day today.
So we wanted to, of course, do a wrap show with you and congratulate you. It was an amazing event. There were so many cool, interesting, smart people here really changing healthcare data. And how do you do it? How do you do it?
Well, I'm surrounded by great people, but it's also a place where we have fertile soil for innovation, and we're deeply rich with data and informatics capabilities here, and then the clinical and scientific rigor that goes on here. So it's a rich environment, and then beyond that, we have fantastic partnerships. So we have colleagues from all around that came, and we were able to put together a meeting that talks about the very necessary intersection between data informatics and digital health innovation, and done well through collaboration.
And there's a lot of really interesting announcements, some stuff that you're telling me about that I couldn't say, but now you can expose that.
Right. We had a few reveals today. One was that we were able to announce the Institute for Computational Health Sciences, which the new head of that has been hired and agreed to come, and that's Atul Butte, who is phenomenal. So we're very excited about that. And then we also were able to announce the first ever challenge grant in Informed Health. So the Informed Health Challenge Grant was announced today thanks to the generosity of Cisco. And then our major sponsor for the conference was Samsung, who underwrote quite a bit of the meeting, and they rolled out the progress they've made on SAMI and SIMBAND, and an invitation for researchers and innovators to participate in co-developing on that platform. So quite a few very exciting reveal moments today.
And it was a heavy-duty event across a number of different areas. Let's do like 3 top points of some of the folks you brought in here and the message you're trying to get out to the world.
I think the message is that we live informed lives in many sectors of our lives. So if I want to get from here over to where I'm going to dinner tonight, I can just pull in data in real time that tells me exactly where I need to go. Yeah. That's an informed life. The same thing when we book hotels or we want to select movies, etc. It's data being made available to us in real time at what I've coined point of choice. So at the moment we want to make the decision, we have the data we need to facilitate making the best decision or optimizing the decision for ourselves. And as much as we like to say that we are evidence-based in our medical practices, it's still very challenging to utilize all the data that really does exist. We need to get through the barriers, and there are many, it's very challenging, of getting data to the moment of point of choice, whether it's a patient or a family member making choices about health, or whether it's the provider and the patient making shared decisions. If the data is not available real time at the moment of point of choice or point of care, it's underutilized.
Okay. And new hospitals launching here in 2 weeks or something like that, right? You guys are
right, beginning of February, and we had a tour of the new hospital. We had a virtual tour first on stage, and then we had a walking, or what I call a net walking tour.
Yeah,
so
net walking.
Yes, and so we were able to continue networking while we walked over the new hospital and actually got to see it and went into patients' rooms. And what I'm interested about in terms of this conference is it's informed health applied. So
instead of just talking about technology and data, that's where does the rubber meet the road?
Right, and how are we going to leverage the really powerful data and informatics into the moment of point of choice in a hospital setting? And so what we've done with that, to further that, is to have what's called the media wall at the foot of the bed of every patient. So patients are going to have much more access to information, whether it's outside the facility or whether it's educational modules that are tailored specific to their needs, or whether it's being able to visualize their labs and x-rays while they're in discussion with their care team at the bedside. But it's very personalized. So data is being pulled out of the medical system, out of the demographic database, out of the electronic medical record. So when they register at the hospital. By the time they get upstairs to be admitted, the media wall is populated with information personalized to them.
Friends and family. It's not just about them. It's about their support network.
Right. There's their support network, but it's patient-centered and patient-engaging and patient-activating.
Okay. So how did you wrap up such a vibrant meeting today?
Well, I decided in the end what I wanted to do was make it really practical. And so I thought I put out a challenge to the audience members to say, at the next moment that you identify as a point of choice, think about what data you would need to optimize your decision making. And then step back and think about how would you get that data there at that moment in real time. And those are the types of exercises we need to do to figure out how we can create an era of informed health like we live informed lives in other areas.
So I think the groundwork here is to do another event like this next year. And how do people out there who want to reach and connect with you and the university here?
So there is a website, which is informedhealth.ucsf.edu, and you can also go to our Center for Digital Health Innovation website. There'll be information. This was a multidisciplinary event, so the informatics websites, the CTSI, et cetera, you'll find a way into informed health from the various sectors, but you could start by simply going to the informedhealth.ucsf.edu website.
And what about your personal Twitter account?
It's A. Sawyer, MD.
All right, well, congratulations. Thanks the staff, the team, everybody behind the scenes that made this happen. Thank you for flying me down from Seattle. It was good to be on the computer with you last night at like 2 a.m., and now it's time for dinner. But thank you, and congratulations. It was epic.
Thank you so much, Tim, because what you've done is you've actually helped us tell the story, which is really important.
All right, well, that's Tim Rhea here with Aenor Sawyer, and we will see you hopefully down here for a tour of the new hospital in about 2 weeks.
Let's do it.